Madam Chair, members, thank you for considering Senate Bill 1967. Epilepsy is a condition defined by unprovoked recurring seizures. About 55,000 Minnesotans are living with epilepsy, and of those, about a third have uncontrolled seizures. 1 in 150 people with uncontrolled seizures may die from sudden unexpected death in epilepsy. These sudden deaths are the leading cause of death in children and young adults with uncontrolled seizures. Those at highest risk are those who have convulsive seizures while unattended at night. Evidence strongly supports that first aid during or shortly after convulsive seizures can be life-saving, and seizure detection devices ensure people with epilepsy are able to receive that attention as soon as possible. These devices are covered under some commercial plans, but not medical assistance. Covering these devices under MA will ensure access to these potentially life-saving devices for people with seizures, regardless of income. I do want to thank my co-authors that span our committee, Senators Abler, Hoffman, Bolden, and Udke too. And I do believe, Madam Chair, that I have a testifier.
Yes, Senator Morrison. Glen Lloyd, and please state your name. Welcome to the committee. Please state your name and begin your testimony.
For sure. Good evening, Madam Chair, members of the committee. My name is Glen Lloyd, and I'm the CEO of the Epilepsy Foundation of Minnesota. Our mission is to lead the fight to overcome the challenges of living with epilepsy and to accelerate therapies to stop seizures, find cures, and save lives. I'm here to speak in support of Senate File 1967, which covers seizure detection devices under medical assistance, advancing health equity in our state. Nationally, 50% of adults living with epilepsy, with active epilepsy, have an annual family income averaging less than $25,000 a year, and about 33% of people with epilepsy are covered under Medicaid. Seizure detection devices can reduce the risk of death and increase quality of life for people living with epilepsy. They alert caregivers when a seizure is occurring so they are able to provide immediate first aid and mitigate potential complications, include sudden unexpected death in epilepsy, otherwise known as SUDEP, status epilepticus, suffocation, and or head injury. Sadly, as mentioned before, 1 in 150 young adults with uncontrolled seizures will die from SUDEP. In addition to income inequities that exist in epilepsy, substantial racial inequities exist in access to care and in outcomes. According to research, African Americans are more likely to experience status epilepticus, and the African American community has the highest age-adjusted death rate for epilepsy from 2005 to 2014. In addition, Black and multiracial infants and children were 1.5 times more likely to die from SUDEP than white infants and children. Please support Senate File 1967. Covering these devices under medical assistance will ensure that there are no financial barriers to accessing these potentially life-saving devices for individuals living with epilepsy. Thank you for your time and support of the epilepsy community. I'm happy to answer any questions.
Thank you very much for your testimony. Members, any questions or comments? Senator Bolden.
Not a question, but just a thank you to Senator Morrison for carrying this bill. As a neuro nurse who's taken care of many patients with seizures and the mom of a son with seizures, this is important and it matters. I also had recently a conversation with some constituents whose daughter lived with seizures, and the peace of mind that this device provided for her family was striking in my conversation with them. So this does make a big difference in the lives of Minnesotans, so thank you.
Thank you. Senator Abler.
So Mr. Lloyd, thanks. And I didn't know all the demographic information. That's really interesting, the income piece and the racial side. I didn't know any of that. Can you tell me how these devices work? I remember I was briefed, but I kind of forgot. So can you just give me the short version of how you don't know what's coming, but it's happening, and then can you just briefly tell me how it works?
Mr. Lloyd.
Chair, Senator Abler, members of the committee, the devices monitor on the risk, very similar to taking biometric information in real time. This is FDA approved, the device that is on the market currently, and so it's monitoring heart rate and a couple other factors that are proprietary to obviously the companies that design these, but they've proven in particular to register seizures that are full body, and oftentimes have proven to be quite effective, particularly at night when the highest incidents of SUDEP occur.
Senator Abler?
And how long have these been out?
Mr. Lloyd?
Chair, Senator Abler, they have the FDA approval came online in 2020.
Really?
Senator Abler?
I talk about this because it's good for people. My son passed from one of those, and if he had one of these, it might not have been fatal. And I never picked up on that even when we were chatting about this. Because he came home with his friends, and they went to 10 o'clock, they went to bed, and he just had a seizure, fell in his bed and aspirated, and they found him in the morning. Well, this little, dinger thing, then somebody might have noticed that. So, I don't mean to make this all so personal, but we deal with like a 1.25 million people in our committee with so many needs. And you don't always know what they look like. They could be your neighbor, they could be any of us. And so I'm happy that this got invented. And we tried to get this done last year, and it just didn't work. Anyway, so thank you.
Thanks, Senator Abler. Senator Morrison, any other comments about the bill?
No, Madam Chair, but I do want to thank Senators Bolden and Abler for sharing their personal experiences and just illustrating how important this is and how it could be life-saving, how it is life-saving now. So thank you for considering, and thank you to Dr. Taylor for being here.
Thank you. Members, if no other questions or comments, we will lay Senate File 1967 over for possible inclusion. Thank you, Senator Morrison.
Thank you.
Thanks, Madam Chair.